A lot of these tendinous insertions go onto the tibia that we rely on to bear weight when we're doing things like running, jumping, squatting. Now, a lot of these injuries, these overuse injuries, if they're not properly addressed, then they'll go on to create much bigger problems down the line. So I'm going to be doing a voiceover here because of an audio glitch with a new microphone. But what we're doing here is we're talking about one of the common injuries is the tensor fasciae lata, or the IT band syndrome. What happens is we have a muscle that starts at the top of our iliac spine on that lateral aspect of our pelvis, and then it goes all the way down and it crosses over onto that lateral aspect of the tibia or the fibula, actually both of them, as the IT band. Now this can often get very tight. It crosses the joint, it's actually inserting over here. Now what happens in overuse injuries, and what we keep talking about, these tendinous type injuries. So what I'm going to explain here is when the IT band, the way it inserts on that anterior lateral aspect of the tibia, when it crosses over, it can get very tight and have a tendency to pull the knee valgus or knock-kneed. What will happen is that can compress the lateral aspect of the IT band and cause it to be tight and start to compress the outside of the knee and give you pain on the lateral aspect, but it can also expose by opening up the medial portion of the knee, causing a lot of pain on the medial portion as well. So you could have two different sources of pain from two different aspects of faulty mechanics in your running. This can often be caused by overpronation of a flat foot, or a little bit of eversion, as we would say, in the foot. Maybe you don't have the right medial support or medial arch support on your sneakers, or perhaps there are bones in the foot that actually need to be adjusted, or actually strengthening the intrinsic muscles of the feet. So that was the TFL, and now we're going to go on to the pes anserine. So the pes anserine is the insertion point of three muscles: the semitendinosus, the gracilis, and the sartorius. This is a part of our hamstring and adductor muscle group on our leg, and it's often overlooked, and that's what I'm discussing right now in the video, is that this is often misdiagnosed as a patellofemoral syndrome or some kind of a kneecap pain, when in actuality these are just referrals from, again, overuse, not properly treated and never healed tendinopathies, this time of the medial portion of the muscles. This one is what I find to be the most overlooked and not treated properly, because it's actually very hard to do the proper soft tissue or manual therapy techniques to this area. So when this is inserting on part of your tibia, this can lead to a lot of pain referral around the kneecap, and oftentimes this getting worked on over just a couple of sessions can have tremendous results. And again, that would be probably what's going to be diagnosed as a pes anserine bursitis. Of course, not to overlook the importance of specific adjusting for the nerve roots in the spine that actually innervate these areas. But it is a soft tissue technique that takes a certain amount of skill, because we need to be able to properly and with the right biomechanics distract the joint to get the fluid out of the joint. The last bit of clear audio there was to emphasize how we use our proper mechanics to make sure that we can work on the periarticular swelling around a joint in a situation like a tendinitis or a bursitis. These are things we're very comfortable caring for, and we hope that you got something from this video, and to see how we work on extremities and overuse injuries here at Paramount Chiropractic and Wellness in Richardson, Texas. Thank you very much. Feel free to reach out with any questions. God bless.